Today we are going to be talking about the barium enema. The definition of a barium enema is the study of the large intestine. It requires the use of contrast media to demonstrate the large intestine and its components. It is also known as BE and lower GI series. The purpose of a barium enema is to demonstrate radiographically the form and function of the large intestine to detect any abnormal conditions. Studies can be single or double contrast. Single could just be barium itself, or double contrast can include barium and/or a negative contrast like air. Contraindications of barium enemas include perforations, large bowel obstructions, and appendicitis. Clinical indications of barium enemas are colitis, ulcerative colitis, diverticulosis, diverticula, intussusception, neoplasms, adenocarcinomas, polyps, and volvulus. Patient preparation for barium enemas include cleansing of the entire large bowel, which is paramount importance for a satisfactory contrast media study of the large intestine. Cleansing can be done with the usage of laxatives before the appointment. Room preparation for barium enema includes first cleansing of the room. Then you will put on a new pillowcase and sheets on the fluoro table. The control panel should be set for fluoroscopy on whatever the radiologist would like to use. If working with C-arm in the radiology department, or CR, have IRs ready for possible post-evaluation images. Those are usually per the radiologist. Lead aprons should be available for anyone that will be working in the room. Lead aprons and also thyroid shields. The table should be in a horizontal position with chucks on top of the sheets in case of pre-evacuation of the contrast media. The Bucky tray should also be at the foot end of the bed so it does not be in the way of the anatomy. The foot pedal should also be in a position that the radiologist wants so they can easily press on it during the procedure. Tissues, towels, replacement linen, bedpan, extra gowns, room air freshener, and trash cans should also be readily available in the room. Contrast media should be hung up and ready to go at the foot end of the bed. Supplies for a barium enema include tissues, towels, linen, gowns, barium enema containers, enema tips, barium contrast, or if there is the perforated bowel or other contraindications, iodinated water-soluble contrast should be used. Also, hemostats. The tech and student roles during a barium enema include room preparation, which you already went over, inquiring patient history from the patient itself or from charts. These can include if images have been taken before, and it is good to get a good patient history from the patient and see if there is any contraindications. Usually the department has a sheet of questions that you go through before the exam. You will then want to explain the exam to the patient using layman terms. You will then give duration of time of the exam. This is a part of ADIT. Ask for pregnancy if it is a female patient. You'll also want to use your 2 patient identifiers like name and birth date. Usually before the patient is in the room, the contrast should already be prepared. This is done by the rad tech or by a student with a rad tech assistant. They will also assist the patient with post-procedure steps. This includes helping them to the bathroom and explaining that after the procedure, they will notice probably some white substance in their bowel matter, and that is normal, just to make sure to hydrate. The tech and student roles also include insertion of the enema tip itself and taking the post-procedure images if wanted by a radiologist. Contrast preparation includes that the room temperature water is recommended by most experts. You will also need to shake the enema bag due to suspension of barium in water. Enema tip insertion is next, and this is done by the rad tech or the student. You also will want your patient dressed in a gown. The very first thing you want to do before doing the enema tip insertion is washing your hands and putting on gloves. The first step is describe tip insertion and answer questions that the patient may have. The patient could be very nervous at this point, so make sure to keep them involved and talk with them and try and calm them down the best that you can. The next is place the patient in Sims position. This will be on the stomach, turned up a little bit with one knee up, exposing the butt area. You will then want to shake the enema bag, like I said, to avoid the suspension. You will then want to coat the enema tip with a lubricant. On expiration, direct the tip into the rectum. After insertion, advance tip slightly anterior. Do not force the tip. Then you will want to tape tubing to prevent slippage so it does not come out of the area that you want it. You will also want to make sure that the balloon is closed until the radiologist is in the room. Next will be the fluoroscopy routine when the radiologist comes into the room, and they will work the fluoro tower. The tech or student will unclamp the hemostat so that contrast flows to the rectum per the radiologist. The radiologist will then see how the contrast flows through the lower GI. Post images are the last thing for barium enema if the radiologist orders them. If they do, the patient can be placed in either of these positions, AP or PA, RAO, LAO, LPO, or RPO. Again, these are only done if wanted by the radiologist. After the procedure is done, you will help the patient to the bathroom to evacuate any barium left in the rectum. And that is a barium enema.